As Inez logs into the employee portal, she clicks here to report a work injury or illness. Next, she records details about the incident. Once Inez has finished completing all of the details about the incident, she submits at the bottom of the page. This will automatically task someone on the clinical side to notify them of the incident. If this is a critical injury, Inez can go directly to the Better Corp Health Clinic. If she would like to look for available appointments, she can also do that from the portal by clicking on My Appointments. This allows her to schedule a new appointment and look for available times. Once she submits the appointment request, an appointment confirmation email will automatically come to her email account. This will block this time as a private appointment on her calendar. At this time, Inez can go ahead and log out of the employee portal. The nurse Nicole can see that Inez is in the waiting room and can click here to move her to an exam room. Next, she can open her chart, and the system automatically opens the appropriate visit encounter based on the appointment type. For the chief complaint, Nicole will document the reason for the visit. The history of present illness will document details about what the employee was doing just before the incident occurred. To the right will show information from the previous visit, including the details Inez typed into the employee portal. The nurse can review that information and click the arrow buttons to pull it into today's visit. She may then click into the free text field and make any changes or add additional documentation. The next section will list any existing cases for this employee. Nicole will click here to open a new case since this is a new injury. If there are existing cases listed here, she could link to this visit as an existing case and it would pull forward all of that case information into the visit. Case management fields are embedded into the visit encounter, so there's no need to switch screens or applications. Nicole is able to document entry details and complete required fields in the case template. Anything with a red asterisk is a required field and will document details about the incident. Information from the HPI pulls forward into the case. When workers' comp related is marked yes, there are additional fields to indicate the claim status, claim resolution, investigation, date determined recordable, and date time workers' compensation forms were given. Enterprise Health also has the capability to interface directly with workers' comp carriers. The clinic can send incident information electronically to the carrier and receive back the determination which updates the case status and adjuster information. In the Nature of Injury or Illness section, there is a drop-down of different types. This drop-down is configurable. This was a strain of the lower back, and Nicole can document that here with any additional comments. All of the case information will save and display on the screen. If the nurse needs to go back and edit any of that information, she may click on the gray header to open that section to make changes. Nicole can review all of the past medical history information which pulls forward from visit to visit. To add information, she simply clicks on the gray header to open that section. If she wants to document an existing medication for this employee, she can start typing the name of the medication here. It will search by brand names, generic, and over-the-counter medication. Once Nicole chooses a medication, it will show the different strengths that medication is available in. She can also document how they take the medication. It also brings up the most common reason someone might take that medication. She can choose from a list or free text and indication. All of the data in the past medical history is coded data for reporting purposes and also to trigger any drug interactions, contraindications, or drug diagnosis alerts. Nicole takes Inez's vitals on a monitor that interfaces with the Enterprise Health solution. This eliminates the need for Inez to manually enter information, and any vitals that fall outside of set reference ranges will automatically trigger an alert. To enter vitals, she clicks on the Vitals section. It defaults to today's date and time, and she can add in the vitals. As she types in the height and weight, it automatically converts the height to inches, and when she enters the weight, it automatically calculates the BMI. At the bottom of the Vitals section is a Vital Flow sheet which shows vitals information from previous visits. Once the nurse is finished entering all the information, she can then select the Provider button at the top. This saves all of the information and marks the encounter as ready for the provider to see the patient. When the provider, Dr. Patel, logs into the system, he sees a list of clinic visits by stage. There is a provider section that shows all the visits ready for the provider. This shows Inez Garza's visit and how long she has been in the exam room. Dr. Patel can click here to go into her visit encounter. He can review all of the information that was entered by the nurse, including details about the case and past medical history information. In the review of systems, each area has a drop-down with a normal statement which can be changed when appropriate. Any of these 3 text fields also support voice recognition, so Dr. Patel can use Dragon voice recognition or can use the voice capability on an iPad device. Each drop-down also has the ability to enter exception statements or free text in any of these areas. The physical exam section works the same as the review of systems. There is a drop-down with a normal statement for each one, or the provider can use free text or use voice recognition in those areas. If there is a previous visit, information from that visit will show on the right in both the review of systems and the physical exam. The provider can use the arrow keys to bring that information over to today's visit. Next, Dr. Patel will add a diagnosis for the visit. He can search by code or description. If he types in back pain, he can choose low back pain and add any additional notes here in the notes section. There is also a free text narrative field in the assessment. Next, he can review the incident summary and click the section to make any changes. To order or prescribe medications, he clicks here and starts typing the name of the medication that he would like to prescribe. This brings up an autocomplete drop-down which includes generic names, brand names, and over-the-counter medication. He can also see different strengths that the medication is available in. The eye icon will bring up the drug guide for more information about that particular medication. There was also a dose button, which will bring up dosage guidelines. Once he types in the duration, the system automatically calculates the quantity based on his SIG. He can say that there are no refills, that he will allow substitution or generic, and indicate the reason that Inez is taking this medication. He can also type a note to the pharmacist that would transmit when the prescription is sent electronically. Next, Dr. Patel will add a restriction for Inez. There is a drop-down of different restriction types and an editor to make changes to those choices. There are also different subtypes and a comment field for additional comments. This links out to active problems that are in the diagnosis list. Dr. Patel can indicate that this is a temporary restriction by putting start and end dates. There is also a checkbox if this were a permanent restriction. The restriction will automatically link to the case that's open in the visit encounter. It also defaults for the provider that's currently logged in as the provider for the restriction. If the restriction is being accommodated, Dr. Patel can indicate that here, or if Inez will have lost time, he can choose lost time from the drop-down. In the introductory field, he can complete a narrative for work restrictions that will be shared with the employee's supervisor. This will display on the final work status report, which will summarize any vital medications, allergies, medical history, and restrictions. To complete the visit, click Archive and Close. This will close the encounter and create documentation of the visit, including the separate work status report. The final visit documentation only includes the sections that were completed as part of the exam. A separate work status report prints as well with general information about the restrictions and accommodations, information on future appointments that are scheduled, and all of Inez's open cases. The work status report is immediately available on both the employee portal and the supervisor portal. The Enterprise Health solution may also be configured to email the supervisor automatically. Because this case was created as part of the encounter, the document management engine in Enterprise Health automatically completes the OSHA 301 form as well as state-specific doctors' and employers' first report of injury forms with the case data rendered in the appropriate fields. All of those forms are located here under Add Document. This is a forms library section where any company-specific forms can be loaded and the system will overlay discrete data onto those forms. To pull up the doctor's first report of injury, click here on the form. This will show that document and overlay all of that detail directly onto the form. In addition, the forms are barcoded, so that if they are scanned or faxed back into the system will read the barcode and automatically index all of the information directly into the record. This is the OSHA 301 form, which pulls in discrete data about the employee. It also pulls in specific case information that was put in as part of the visit. All of the case data is also populated onto the OSHA 300 and 300A logs automatically. At the conclusion of the visit, the nurse can click here on the check-in status and change the employee to checked out. This will stop the time tracking, and the system automatically generates reports on the average waiting time and the average time from check-in to check-out. As the case manager, Corey logs into the Reports module. There are different types of reports available. For safety, there is an incident report that can be filtered by various different fields. When searched, the results show up below. All enterprise health reports also export to CSV, so it will open the information in Excel to allow for additional filtering and sorting of the data. The incident report also has a link to generate the OSHA 301 from here. All of the data overlaid will automatically be overlaid onto the form. Likewise, the OSHA 300 log allows for filtering of various fields, and when searched, the data will display down below. The OSHA 300A also allows for various filter fields, and when searched, the results will show at the bottom. Any report in the enterprise health system may be restricted, so only certain departments or individuals can have access to that report. In addition, there are pivot reports available for system administrators that have access. There, the user can drag and drop any field of discrete data in the system to create custom reports. The user can also display the data in graphical context with bar charts, line charts, pie charts, and so on. Pivot reports can be saved and set up to display here under the Report Side menu tab. For more information on enterprise health functionality and features, please visit our website at enterprisehealth.com.